What are your treatment options when you have infection in the mouth, or what we call it as an abscess or a pus pocket in the mouth? Do you know your treatment options? Do you want to find out? Stay tuned. Hi, my name is Dr. Kumar Varivel. I'm a board certified periodontist, a dentist, and a dental specialist, a British trained oral surgeon, practicing over 3 decades. When you have infection in your mouth, and we call it as an abscess or a pus pocket, just like a pimple that you have in your mouth. So we call it as an abscess, just like you see in this patient's mouth here. Look at that pimple. The patient has a tooth on the left side of the screen that you see, the 2 pimples that you see in the mouth. And this is the actual video of the patient's mouth. The reason why the patient has these 2 pimples in the mouth is because of this tooth with the root canal on the bottom right side of her lower jaw is going bad. This is a root canal that was done several years ago, and this root canal is going bad, and there is no way for the infection to escape from the bone or escape from the tooth. And now, because the infection cannot escape, it is trying to push through the gum line, which we call it as the least path of resistance, and it is trying to push through the gum line as a pus pocket. So what are your treatment options now when you have this failing root canal? And now you have option 1, of course, do nothing, we are going to say, but you don't want to leave the infection at the end of the in the mouth, and you're going to let this infection go to the rest of the body. So the treatment options, of course, you do what we call it as a redo of the root canal. So that means you're going to get the root canal redone, and that is going to help you clear the infection. And then the second option is, if you do not want to deal with redoing the root canal, particularly knowing that the first time the root canal failed, and if you don't want to mess with it, we recommend you remove the tooth and clean all the infection, and at the end of the root, as you see the pimples and everything, that you clean it out, and you do what we call it as a bone grafting to preserve the tooth. And after the bone completely heals, or even at the time that you remove the tooth, we recommend you replace the tooth with what we call it as a dental implant, as you see in this picture. So the picture shows the tooth replacement using a dental implant. So when you have an infection in the mouth, talk to your dentist about the treatment option, whether a redo of the root canal or removing the tooth and replacing with the dental implant is an option for the infected tooth. If you happen to be in the Dallas-Fort Worth area, come see us at ToothHQ. We can definitely help you. Until next time, take care.